All right, everyone, get ready for this. We're going deep, deep into the world of goat abortion investigations.
Ooh, that's a good one.
I know, right? And you all wanted this, so buckle up. Our main guide today is this really fascinating chapter from a veterinary manual all about goat diseases.
Sounds good.
Plus, we've got a whole list of extra reading if you really want to go down the rabbit hole later on.
Oh, yeah.
But whether you've had goats forever or you're just getting started, I think you're going to find this fascinating. We're going to uncover some pretty surprising facts and, arm you with the knowledge to ask the right questions.
You know what I find fascinating?
What's that?
It's that even with all the, advances we've made in veterinary medicine, the most common diagnosis we give for goat abortions is still undetermined.
So we're talking about a real mystery then.
Aye.
It's like a veterinary whodunit.
Exactly. Figuring out what causes abortions in goats is, it's like solving a cold case. There are so many potential suspects, but pinning down the real culprit, that can be incredibly challenging.
Oh, I bet.
Yeah, one of the reasons is that just because you find an infectious agent doesn't automatically make it the cause.
Huh. Okay.
It's like finding someone's fingerprints at a crime scene, They could have been there for a completely different reason.
So it's all about context.
Absolutely.
Right?
And to make things even more complicated, there's often this big time lag between when the infection first happens and when the actual abortion happens.
Oh, wow.
It's like trying to figure out a crime scene weeks or even months after the fact.
Yeah, I can see how that would make things tough.
Yeah, the evidence might be gone or the trail's gone cold.
Okay, so let's say you're a goat owner, right? And you're dealing with this mystery. What's the very first thing you should do?
First things first, you got to preserve all the evidence.
Okay.
I mean, everything.
Yeah.
The fetus, the membranes, everything.
Everything.
Yeah, it's crucial because this stuff is like the starting point for any investigation.
All right, so while you're waiting for the vet, you start gathering information, right? You're building that case file. What kind of questions should be going through your head?
Think like a detective.
Okay.
Is this just one doe or is it a whole flock problem?
Right.
Did you bred yourself or did you buy them from somewhere else? What have they been eating? Are their vaccinations up to date?
So even questions that seem really simple, they can provide clues.
Oh, absolutely. Every answer helps us understand, the size of the problem and what the risk factors might be. For instance, if you have a bunch of does that you just bought from the same place and they all abort, that might mean there's a common source of infection.
That makes sense. And what about their diet?
Mm-hmm.
I saw in the manual that they specifically mentioned silage.
Oh, yeah, good point. Silage, if it's not stored properly, can harbor bacteria like Listeria.
Right.
And Listeria, we know, can cause abortions, especially late in pregnancy. And speaking of timing,
Yeah.
that's another really crucial part of this whole puzzle.
It's like we're establishing a timeline for our mystery, right?
Exactly.
The manual even calls Table 2.2 a crime scene timeline.
Yeah, I like that.
What are some things that jump out at you there?
Well, if you see abortions happening throughout the whole pregnancy, suspects like toxoplasmosis, chlamydia, or even just plain stress come to mind.
Really?
Yeah. But if the abortions are mostly happening late in the pregnancy, we might be thinking more about Listeria or Campylobacter.
So knowing when the abortion happened, that helps you narrow down the possibilities.
Exactly. Some infections are more likely to trigger an abortion at specific times during the pregnancy. Like Listeria, that one usually strikes late in the game, but toxoplasmosis, that can cause problems throughout.
Oh, wow. Okay, so we've gathered our evidence, we've interviewed witnesses, and we've established a timeline. Now it's time for the vet to examine the doe. What are they looking for during that clinical examination?
Well, they'll be looking for any signs of illness, anything that might give us a clue.
Okay.
But, and this is important, remember that time lag we talked about?
Yeah.
The doe might look perfectly normal even if she was infected weeks ago.
So even a doe that looks healthy, she could still be carrying vital information.
Exactly. That's why it's so important to examine both the fetus and the placenta. It's like studying the victim and the crime scene for any trace evidence.
So I imagine sending samples to the lab is a crucial part of the investigation, right?
Absolutely, yeah. Lab analysis is essential for figuring out if there are specific pathogens present. We can analyze antibodies and ultimately get a clearer picture of what happened.
Like those forensics labs you see on TV?
Exactly. And just like in forensics, the right specimens are super important.
So we're talking blood tests, bacterial cultures, that kind of thing.
Exactly. And there's also histopathology, which is basically examining tissues under a microscope.
Oh, wow.
Yeah, this can show us really subtle changes that you might miss just by looking at the tissue.
It's like having a microscopic detective on the case.
I like that.
Okay, we've laid some groundwork here. Now let's delve into the lineup of potential culprits, and let's start with those infectious suspects.
Sounds good.
Where should we start our investigation?
Well, let's start with chlamydia, or as it's called in goats, enzootic abortion. This one is a bit of a repeat offender.
Really?
Yeah, it can be really hard to deal with.
And I understand that it behaves differently in goats than it does in sheep.
That's right. In goats, this sneaky little bugger can cause abortions at any point in the pregnancy.
Oh, wow.
Unlike sheep, where it's usually just in those last few weeks. And the incubation period is really short, like a doe can get infected and abort within the same pregnancy.
So once it's in a herd, it can just spread really quickly.
Exactly. Mostly it's spread through contact with aborted material, but carrier animals, they can spread the infection without showing any signs themselves.
Oh, man.
And here's where things get a little tricky. Some of these infections, including chlamydia, can also be a risk to humans, especially pregnant women.
That's a good reminder that these investigations are about protecting everyone, both animals and humans. Okay, moving on to our next suspect. Let's talk about toxoplasmosis.
Okay.
This one's got a connection to cats, right?
That's right. The bad guy here is Toxoplasma gondii.
Okay.
It's a parasite, and it has this really interesting life cycle that involves cats, rodents, and goats. Cats are what we call the deficitive hosts.
Okay.
That means the parasite can, sexually reproduce inside them.
Wow.
So they shed these infectious oocysts in their poop, which can contaminate the food and water and ultimately infect the goats.
And how does the timing of the infection affect the outcome for the goat?
Early on, it can lead to fetal death and resorption,
Right.
which is basically where the fetus is reabsorbed by the doe's body. But later infections might result in abortions, stillbirth, or even weak kids.
So for goat owners, keeping cats away from their herds, that's really important for prevention. All right, let's move on to Campylobacter. What makes this one so tricky?
The challenge with Campylobacter is that some does can become carriers. They have the bacteria but don't show any signs, and they can shed it off and on, which makes it really tough to get rid of from a herd.
So even if you cull the aborting does, the infection could still be lurking.
Yeah, unfortunately. And there's a public health link here, too. Campylobacter can be transmitted through contaminated milk, causing gastroenteritis in humans.
Oh, wow.
So it highlights how important pasteurization is. Now let's move on to a suspect with a kind of scary nickname, Q fever, the silent spreader.
Ooh, I like it. Tell me more about the silent spreader.
Well, Q fever is caused by Coxiella burnetii,
Okay.
and it's known for causing abortions without any, obvious symptoms in the goats themselves. But like chlamydia, it can be a big risk to humans.
So it's silent but deadly.
That's one way to put it. And there's a huge outbreak in the Netherlands. Do you remember that?
I think so.
Yeah, back in 2007, 2009. They had to cull thousands of goats as a public health measure because of a Q fever outbreak that was linked to dairy goat herds.
Wow. Thousands.
Yeah, it's a serious infection. And it's really, really hard to control because it can survive in the environment for years.
Really?
Yeah, it can just cling to dust particles and spread through the air.
So even with, thorough cleaning and disinfection, it can be tough to get rid of.
Exactly. Vaccination is key for controlling Q fever, but different countries have different approaches.
Okay, so we've covered some of the big infectious suspects. What about other potential culprits? The manual mentions a whole bunch more.
It does. We've got listeriosis, which often leads to stillbirths, weak kids, and retained placentas. Then there's leptospirosis. That one's pretty rare in goats, but it can cause septicemia. And there's salmonellosis, where some types can make the does themselves sick, not just cause abortions.
Oh, wow. It's amazing how each infection has its own, unique fingerprint.
Yeah, it is.
What about tick-borne fever?
Oh, right, tick-borne fever. That's caused by a parasite called Anaplasma phagocytophilum. It can really affect goats' health, leading to weight loss, abortions, and even making them more susceptible to other infections. And interestingly enough, Anglo-Nubian goats seem to be more susceptible to this one.
So breed-specific susceptibility, that's another factor in this whole thing.
Absolutely.
Okay, what about border disease?
Border disease. With border disease, the main culprits, or the reservoirs, I should say, are cattle and sheep.
Oh, so it can spread between different kinds of animals.
Exactly, yeah. It's a reminder that when you're managing a goat herd, you have to think about the surrounding environment and any potential interactions with other animals.
And of course, we have brucellosis.
Right, brucellosis. There are actually different types of brucellosis.
Okay.
Some are rare, but others, like Brucella melitensis, can be a big risk to humans. It can cause something called Malta fever.
And we talked about managing cats for toxoplasmosis. What about neosporosis?
Good point.
Is there a similar prevention strategy for that one?
You're right to make that connection. Neosporosis is another parasite, but this one is linked to dogs.
Dogs.
Yeah. Just like with toxoplasmosis, keeping dogs away from feed, water, and especially aborted materials, that's key to reducing the risk.
So responsible dog ownership is important for goat health, too. What about sarcocystosis?
Sarcocystosis is a bit more complicated. It involves this predator-prey life cycle where goats are what we call the intermediate host, and dogs or cats are the definitive hosts. It can be tough to diagnose because it often doesn't have any symptoms.
So we've gone from a single case of goat abortion to this whole web of interconnected factors and potential suspects.
It's amazing, isn't it?
It is. But sometimes the culprit isn't some microscopic invader, right?
Right.
Sometimes it could be hiding right there in the environment.
Exactly. And the thing is, seemingly simple things can cause huge problems.
Okay.
For example, medications like prostaglandins.
Okay.
They're sometimes used for other things in goat management, but they can accidentally trigger abortion.
Oh, wow.
And then there's stress.
Wait, are you telling me that stress can make a goat abort?
Yeah, it's true. Goats are kind of unique in that they rely on this thing called the corpus luteum.
Okay.
It's a structure in their ovaries, and it produces progesterone throughout the entire pregnancy.
Oh, wow.
This makes them more susceptible to stress-induced abortions than other species.
So any stressful event that messes with their progesterone levels can lead to pregnancy loss.
Exactly. And this could be anything from bad weather to the stress of being transported or even just sudden changes in their environment.
Wow, they're a lot more sensitive than I realized. What about developmental abnormalities?
Yeah, sometimes the problem is with the fetus itself.
Okay.
It's not common, but genetic defects or developmental problems can cause a spontaneous abortion.
Yeah.
It's kind of like nature's way of making sure that a pregnancy that isn't viable doesn't continue.
I see. And speaking of multiple pregnancies, the manual brings up Anglo-Nubians again.
Right.
Is there a connection there?
Yes. Anglo-Nubians are known for having multiple births, often 3, 4, or even more kids. But too many kids can actually be a problem sometimes. It's a lot of stress on the doe's system, and that can lead to something called placental insufficiency, which can then cause an abortion.
So even though having multiple kids is a good thing, it can also have downsides.
Exactly.
What about poisons?
Mm-hmm.
Is it just plants, or are there other things that can be toxic?
Well, plant poisonings definitely happen, but other toxins can be a factor too, like chemicals, pesticides, or even contaminated feed.
So goat owners need to be really careful about the environment and make sure that goats don't have access to things that could be harmful.
Definitely.
And of course, we can't forget the basics like nutrition.
Yeah, good nutrition is so important.
I bet.
Pregnancy takes a lot of energy and nutrients for both the doe and the developing fetuses. If a doe doesn't get enough energy or is deficient in certain minerals like selenium, copper, or iodine, that can really mess up fetal development and make her more likely to abort.
So a balanced diet and clean water are essential for healthy pregnancies.
Absolutely.
What about mycotoxins? What are those exactly?
Mycotoxins are these toxic compounds produced by certain types of fungi.
Fungi, okay.
Yeah, and they can contaminate feed. They're sneaky because you can't usually see them, but they can have a big impact on animal health.
So proper feed storage and quality control are important to prevent that from happening.
Exactly. By managing these environmental factors, goat owners can really help minimize the risk of mycotoxins affecting their herds.
Wow, we've covered a lot of ground already. It's incredible how many things can contribute to goat abortions. But this is just the beginning of our investigation, right?
Oh, yeah. In the next part of our deep dive, we're going to explore the super important roles of biosecurity and diagnostics in preventing and investigating these cases.
So stay tuned because this mystery is far from solved.
Welcome back to our deep dive into goat abortion investigations.
It is pretty fascinating, isn't it?
It is. We're starting to see, I think, just how complex this whole issue can be. Oh, yeah. Absolutely. It really is like peeling back the layers of an onion.
Yeah.
It's always something else, another layer of complexity.
We've looked at a whole bunch of potential culprits, right?
We have.
Infectious agents like chlamydia,
Right.
Toxoplasma gondii. We talked about environmental factors like stress and nutrition.
Mm-hmm.
But there's this one really crucial aspect that we haven't really talked about yet, and that's biosecurity.
Yeah, that's a great point. Biosecurity is essential, absolutely essential for preventing these infectious agents that can cause abortion. You're basically trying to build this protective bubble around your herd.
So where do we even begin with building this protective bubble? What are some of the key things that goat owners need to be thinking about?
Well, it all starts with controlling who and what has access to the herd.
Okay.
That means limiting contact with any outside animals, especially if you don't know their health history.
Right.
So if you're bringing in new goats, you want to quarantine them, keep them separate for a while, and watch them carefully for any signs of illness.
So no casual visits from the neighbor's goats.
Exactly, yeah. And it's not just about other goats. Remember all those wildlife connections that we talked about? Rodents, birds, even those feral cats, they can all carry and spread infections.
Right, like toxoplasmosis and sarcoidosis.
Exactly. So you really want to make sure that your barn and feed storage areas are secure and protected.
So it's not just about the goats themselves.
No, not at all. And don't forget about people, too. Visitors can accidentally bring in pathogens, too. So it's a good idea to have some dedicated footwear, boots or something for anyone who's coming into the barn.
Oh.
And make sure everyone washes their hands thoroughly.
So biosecurity is like this really broad approach.
Yeah, it is.
You're trying to create this fortress around the herd to minimize any exposure to potential threats.
That's a great way to put it. And it's not a one-time thing either. It's an ongoing process that requires you to be really vigilant, to pay attention to the details. It's not just about putting up physical barriers. It's about establishing routines and practices that become second nature.
Okay, so we've talked about preventing the introduction of these culprits. But what happens when we suspect that an abortion has already happened? How do we approach the diagnostics then?
Well, that's where those initial assessment questions are so important.
Right.
The information that you gather about the doe's history, when the abortion happened, any clinical signs you've seen, all those pieces, help you create a diagnostic plan. It's like putting together a puzzle. You use each clue to narrow down the possibilities.
So it's this back and forth, right? Between the goat owner and the vet, combining observation with expertise.
Precisely. And remember, there's no one right way to do this. The diagnostic plan will be different depending on the situation.
So what are some of the tools that a vet might use when they're investigating goat abortions?
Well, we've already talked about a few of them. Blood tests to look for antibodies, PCR to find specific pathogens, bacterial cultures to actually isolate and identify those tiny culprits. But there's also histopathology.
Histopathology. Now that sounds a little intimidating.
It might sound complicated, but it's really useful. It basically involves looking at tissues under a microscope. Think of it as zooming in on the evidence, trying to find those tiny clues that you might miss just by looking at the tissue with the naked eye.
So it can tell you things like how the animal died, whether it was from an infection or trauma or something else entirely.
Exactly. And by using different diagnostic methods together, we can get a clearer picture, and that increases the chances of finding the culprit and figuring out what to do.
So it really is like a veterinary CSI episode. But let's shift gears now and talk about prevention. What are some things that goat owners can do proactively to reduce the risk of abortion in their herds?
Well, prevention goes hand in hand with biosecurity. If you can minimize the introduction of pathogens to begin with, you're already reducing the risk of infection. But there are other things to consider too, like vaccination.
Right. We talked about vaccination earlier for Q fever and toxoplasmosis. Are there vaccines for other causes of abortion too?
Yes, there are. There are vaccines available for chlamydia, campylobacter, and even some types of salmonella.
Okay.
It's really important to work with your vet to come up with a vaccination program that's specific to your herd's needs.
So it's not a one-size-fits-all kind of thing. What about nutrition? What role does that play in prevention?
Nutrition is so important. I can't stress that enough.
Right.
Making sure that your does have good quality forage, supplemental feed if they need it, and enough minerals and vitamins, that's all crucial for supporting healthy pregnancies. It's like giving them the building blocks for strong fetal development and a healthy immune system.
And we can't forget about managing stress, right?
Absolutely. We've talked about how sensitive goats are to stress.
Right.
So making sure they have a comfortable environment, that's key. Enough space, good ventilation, protection from the elements. You also want to minimize any sudden changes in their routine, like big shifts in their diet or housing, or changes to the social groups, especially during pregnancy.
It's all about stability and predictability.
Exactly.
What about regular vet checkups?
Oh, those are important too. Regular vet visits are a key part of prevention. These checkups give the vet a chance to see how the herd is doing overall, catch any potential problems early on, and give you advice tailored to your specific situation. It's about being proactive with their health care, not just waiting until something goes wrong to call the vet.
So preventing goat abortion, it's like a multi-pronged approach.
It is.
It's biosecurity, vaccination, nutrition, stress management, and regular veterinary care. It seems like a lot to keep track of.
It is a lot, but by taking this, holistic approach and really making the health and well-being of your herd a priority, you can significantly reduce the risk of abortion. And remember, veterinary medicine is always changing, so it's important to stay up to date on the latest research and best practices.
That's what makes this whole field so fascinating, isn't it? There's always something new to learn.
Definitely.
We've gone over a ton of information in this deep dive, but we're not done yet.
No, we're not. And in our final part, we're going to put all this knowledge to work. We're going to look at some case studies.
Oh, that's a good idea.
Yeah. We'll see how those detective skills that we've been talking about actually come into play in real-life scenarios.
So stay tuned, because we're about to put our investigative skills to the test. Welcome back, detectives. Are you ready to put all those detective skills that we've been working on to the test?
I am.
In this final part of our deep dive, we're going to walk through a couple of real-life scenarios. We'll see how all that knowledge we've been gathering from the veterinary manual and all those extra readings, how it all comes together in practice.
I'm excited to see how those clues and the diagnostic tools, how it all works in real life. It's one thing to understand the theory, right?
Yeah.
But it's a whole other thing to apply it to real situations.
Exactly. So let's dive right in. Let's say you're a veterinarian and you get called out to a goat farm, and the owner is telling you that a few of his does have aborted late in their pregnancies. And he's really worried, especially since he's never had abortions in his herd before.
Right. So we've got multiple abortions happening, and they're happening late in the pregnancy. That's a crucial piece of information right there.
It is.
It helps us narrow down the possibilities in our list of suspects.
Thinking back to what we've learned, those late gestation abortions, they point us towards listeria, campylobacter,
Right.
Q fever, maybe even salmonellosis.
You got it. Now, as you're talking to the owner and getting more information, you learn that the does haven't been showing any signs of being sick. They've been eating mostly hay, they have access to pasture, the vaccinations are all up to date, and the owner hasn't noticed any unusual stress factors.
So there are no obvious red flags, right?
Right.
In terms of their management or their environment. But this lack of symptoms, this is kind of a puzzle, isn't it?
It is, but remember that time lag that we talked about?
Yeah.
It's totally possible that the infection happened a while ago, maybe weeks or even months ago,
Right.
and the does have actually cleared it from their systems.
Ah, so they might look healthy now, but they could still be carrying those clues, like a silent witness.
Exactly. And that's why examining the aborted fetuses and placentas, that's so important in these cases. They can often give us information that the does themselves can't.
Makes sense.
So in this case, you notice that a few of the fetuses are showing signs of autolysis, meaning they've started to decompose, and the placentas have this leathery look with a yellowish discharge.
Ooh, interesting. Okay, so those are visual clues. What are those telling us?
Well, the autolysis tells us that the fetuses died sometime before they were aborted. And those leathery placentas with that yellowish discharge, that points towards a bacterial infection as the most likely cause.
So our bacterial suspects are looking more and more suspicious.
They are. And based on what you've seen, you recommend running a bunch of different diagnostic tests. Bacterial cultures from the fetuses and placentas. Those will help us isolate and identify the specific bacteria. We can use PCR to see if specific pathogens are present, and histopathology will let us look at the tissues under a microscope for any subtle clues.
So let's say the results come back and they're positive for Campylobacter.
Okay.
What happens next?
Well, now we know who the culprit is. So the owner can work with the vet to come up with a plan to get things under control.
Right.
This would probably involve separating the aborting days, maybe culling them to prevent them from becoming carriers, and treating the rest of the herd with antibiotics based on what the specific bacteria is sensitive to.
And I imagine reinforcing those biosecurity measures to prevent any future outbreaks, that's super important too.
Oh, absolutely. This whole case just shows how important it is to be really observant, to do the right diagnostic tests, and to have a good understanding of what can cause these abortions. It's like solving a puzzle, carefully putting each piece together until you see the full picture.
Exactly. Okay, let's look at another case. This time, you get called out to a farm where a single doe has aborted, but it happened in mid-gestation.
Okay, mid-gestation, all right.
The fetus is pretty fresh. There are no signs of decomposition.
Okay.
And the doe herself, she seems healthy overall, but the owner has noticed that she's been losing weight, even though she has access to good hay and pasture.
Interesting. So this is a bit different from our first case. We have a single abortion, mid-gestation,
Right.
a fresh fetus, and a doe who's losing weight despite having good nutrition. What are your first thoughts?
Well, mid-gestation abortions, those could be caused by a bunch of different things like toxoplasmosis, chlamydia, even stress. And then you add in the weight loss, that adds another layer, right?
It does.
It could be a nutritional deficiency or maybe even a parasitic infection.
Yeah, those are all good possibilities.
Mm.
So you talk to the owner some more, and he mentions that he brought in a new buck to the herd recently. He got it from a good breeder. The buck seemed perfectly healthy. But the owner hasn't actually seen him mating with any of the does.
Interesting. So we have a new male in the herd. Might not even be breeding. Could this be brucellosis?
That's a great thought. Brucellosis is often linked to those late gestation abortions,
Right.
but it can cause infertility and other reproductive issues too. So even though this abortion was in mid-gestation, we can't rule out brucellosis just yet.
So you always have to keep an open mind.
Always.
Right.
You got to consider all the possibilities. So given all this, you would recommend doing serological testing for brucellosis, both for the doe and for the new buck.
Okay.
And because the doe's losing weight, you'd also suggest checking her poop for parasites and doing blood tests to see if she's deficient in any nutrients.
Let's say the brucellosis tests are negative, so we can cross that one off our list. But the fecal test shows a heavy parasite load,
Okay.
and her blood work shows that she's deficient in selenium.
So in that case, it's very likely that the abortion was caused by a combination of things, the stress from the parasite infection and that selenium deficiency. This case just highlights how things that seem unrelated can actually work together, to create this perfect storm that ends in pregnancy loss.
It's like you're a detective at a crime scene, right?
It is.
You have to look at every angle, every little piece of evidence.
Exactly. Well, I think we've successfully tackled a couple of pretty tough cases today. What are your final thoughts?
We've covered a lot in this deep dive, but I think the most important thing to remember is that when it comes to investigating goat abortions, things are rarely simple.
That's for sure.
It takes careful observation, critical thinking, asking the right questions, and really understanding all those factors that can be at play.
I agree. It's about being a detective, gathering evidence, following the clues wherever they lead, and never assuming anything. And remember, everyone, this deep dive, it's just the beginning. It's giving you a foundation.
It is, and I encourage everyone listening to stay curious, keep learning, never stop looking for answers. The world of goat health is huge and complex. There's always something new to learn.
That's right. So that wraps up our deep dive into goat abortion investigations. Until next time, keep those detective hats on.